Hi, I'm Dr. Mitzi Waltz. I work with the Athena Institute at Vrije Universiteit Amsterdam, and I'm here to talk with you about mobile crisis services and neurodivergence. I've been an autism researcher for a pretty long time, and this is an area where there isn't a lot of information, but there is a lot of information that I can give to you to help you develop your practice and to meet the needs of this population. So, our agenda today, I'm going to explain a little bit about what I mean by neurodivergence. I'm going to share a story with you about a neurodivergent person, a real person who has experienced different forms of houselessness. We'll talk about the size of the problem, what you can do to meet people's service needs who are in this category. And then I've got a slide with a few key takeaways that would be very valuable for mobile crisis teams, for people who are thinking of starting mobile crisis teams, and also for other service providers who are doing different kinds of services but want to know more about this population. So, what is neurodivergence? Most of the time, when people hear the word, they're thinking autism, and that's probably the biggest category within the neurodivergent category. But the broader definition includes a lot of brains that work differently. So, people with ADD and ADHD, people with dyslexia, people with dyspraxia. And the key thing for us is how these categories intersect with mental ill health and homelessness. The important thing to know is that none of these things are uncommon. Autism, around 1 to 2% of the population meet the DSM criteria for autism. And whatever you think of the DSM, and I'm not one of those people who thinks a whole lot of it when you come down to it, it does describe something. Differences in how people understand social communication, social situations, differences in behavior, and differences in communication style or ability. And there is a huge range. When people say that autism is a spectrum, that spectrum ranges all the way from, it could be me, right? It could be someone I work with, someone who's very articulate, but who does struggle in other areas of their life, to someone who also has an intellectual disability and could have additional health conditions or problems alongside it. Dyslexia is even more common. Around 20% of the population, we all know someone who has dyslexia for sure. And of that group, about 10% are quite seriously affected. So it might be affecting their ability to be literate, to handle any kind of form that you put in front of them. Others struggle, but they have workarounds, maybe they manage. But there is that group who it is a very significant difficulty. Dyspraxia is less well known, but it affects about 6% of the population. It affects eye-hand coordination, so fine motor coordination and gross motor coordination. And a lot of people are undiagnosed who are dyspraxic. It will affect people in their education and in their work, and it can affect their speech. Verbal dyspraxia is definitely a thing, and it can result in difficulties in being understood, and that could be misunderstood in a street situation as someone who's taking alcohol or drugs. You might think that's why they're slurring or not speaking very well. It could also be dyspraxia. ADD or ADHD are also pretty common. The estimates range from 3 to 10%. I'm not so sure about that because I think that we tend to medicalize or problematize different activity levels in children. And that could be an issue that people carry with them into adulthood, that label, and it may not really mean anything. But it does affect attention and impulsiveness and behavior. And we know that impulsiveness and behavior are two things that can definitely result in people coming to the attention of services or falling through the cracks in society and ending up houseless. The other important thing is that these categories are not super separate. There's a lot of overlap, and many people are not diagnosed. One other important thing about autism is that those differences in social understanding and behavior, those are the things that are in the DSM. The thing that's usually most important to people with autism themselves is the differences in sensory perception and sensory experience. So the way that they actually perceive the world, the way that things sound to them, feel to them, can be quite intense. And that is the thing that causes them the most difficulty. And it's super important to be aware of that when you're providing services. But these are just differences. And being different is not the same thing as being mentally ill. Even though all of these conditions might attract the attention of a psychologist or even a psychiatrist, some people may be prescribed medication, some people may have experience of the mental health system as a result of these diagnoses. They aren't actually mental illnesses. They're just ways that people's brains are organized that are different. And those differences have been with humanity a very long time. I recently saw some research that shows that several of the major genes that contribute to autism are present in other primates and have been in humans for at least 20,000 years. I mean, that tells you this is probably functional on a long-term basis, but not always functional in our world, where we have really strict expectations of people that are getting narrower and narrower, one might argue. There are also some issues that can lead to mental ill health. The important one is that children who are neurodivergent are more likely to be neglected and abused in their families of origin. They don't act the same as other children. They may do things that, I don't want to say anything attracts abuse, but that could be difficult for parents and other caregivers to manage. And that can end up in situations that are quite unfortunate. That leads to a lot of adverse childhood events that can include things, not only abuse in your family or neglect in your family, but being thrown out of school at an early age, or being subject to physical holds at an early age. I have a son with autism, and I was trained to do that in Portland as a parent when he was 4 years old. And he was in a program where they used physical holds up to 20 or 30 times a day. That has a traumatizing effect. And I'm very sorry that it happened with him. It wasn't the right thing, but this is not an uncommon experience. We know that there are a number of people in this group who end up with PTSD. And so that is a mental health condition and adds to the complexity. These are people, especially when you're looking at people with autism, who are less likely to form reliable, lifelong relationships. These are the relationships that help you stay housed, that help you stay stable, that help you find jobs, and that protect you from things like depression and anxiety. These are people who are less likely to achieve good results at school. So these are people who may leave school early without qualifications, who may have quite an uneven educational background. And with some kids, they've experienced forms of education, I'm going to put that in scare quotes, that are traumatizing in of themselves. Extreme control kinds of situations, which are probably not a great match for the way that their brains work. And it makes them quite wary about continuing education or being in situations where people have physical control over them. Parents are pushed, and I've been there, to force their child who's neurodivergent to conform. You're rewarded for that. And when your child isn't capable of doing that, that can lead to a real problem in the family home. You feel you failed. Your child may become very angry with you because of the things that you're doing. And you can see family breakdown where young people are leaving home at an early age or ending up in mental health facilities during their teenage years that are not well matched to what they need. And so that has mental health consequences, being pushed out or running away at an early age. We know that's how a lot of people do end up on the streets. It begins in those teenage years with family conflict. Important for you to know is that support services are really thin on the ground, and I'm going to explain why. A lot of people think there's a great deal of support out there for young people with autism, and especially for adults with autism. There really isn't. And some of the support that's offered does not feel supportive to the people who receive it. The support is geared toward the needs of parents, and parents have support needs, but their support needs can be very different from the support needed by the young person. And certainly when we come to adults, support designed for a parent is not really what they need. The school to prison pipeline also plays a role here, especially for minority ethnic young people and adults. You are more likely to not get a diagnosis of autism if you're Black, Hispanic, or Native American, despite having the same behaviors, the same way of seeing the world. You're more likely to get a diagnosis of being emotionally disturbed or being a behavior problem, which will put you on that pipeline and unfortunately can have lifelong results, including on your mental health. I like this quote, but I don't like what it has to say. Many people with autism experience a triad of trauma: neglect at home, meaning neglect of certain needs that they may have because other things are being prioritized by the school system, by parents, by people in charge; abuse from trusted adults, which they often are told they can't call abuse, even though that is what it is and is what it feels like; and bullying at school or work. And I know the statistics on bullying indicate that almost every young person with autism has experienced bullying at school. Bullying at work is severely under-researched, but I know of many, many cases of really awful behavior by grown-ups who should know better, bullying young people, older people with autism in their jobs and bullying them out of a job. That's a lot to deal with. And these are all things that can land people in the mental health system or on the street or both. So I'm going to tell you about a real person. And this is someone that I know in the UK. And it's just a little piece of his life story. He left school at 16. You can do that in the UK. That's legal. He had not been diagnosed, and he didn't have any qualifications. He hadn't finished all of his school exams, and those are the very basic school exams, the things without which you can't get a job. He got on a bus to London, and he went to what was called Cardboard City, and that was an area around Hyde Park, not Hyde Park. It's an area around King's Cross where people were street sleeping. With cardboard boxes, the kind of Thatcher era stuff that was going on in London. He was there for a few weeks, and it was really, really frightening to be a teenager in that environment, especially a teenager who didn't see the world the same way everyone else did. He dealt with a lot of anxiety and fear, and pretty soon he met some people who were squatting and moved on to a different kind of houselessness. He became quite a clever resource person in that scene. He was willing to do things other people weren't. He didn't have any scruples about, things that breaking into buildings, for instance, finding a way in. He learned a lot of skills. Some people might say they were antisocial skills, but other people would say they're survival skills. Eventually, he moved closer to his family of origin, even though they were abusive, and lived on the margins, sometimes squatting, sometimes in a room or a flat. And during that time, he grew and sold cannabis quite successfully because being a person without a big social network, there was no one to blab to. He just did what he needed to do. He never used mobile phones. He never used email. He never came to the attention of the police. He was Mr. Invisible, very handy for him. But it has to be said that that world can also be quite dangerous. So during those years, he experienced assaults and threats and meetings with, actual criminal gang members who were quite scary. And eventually he became homeless again and presented to the local council. In the UK, you have technically a right to housing, although that's broken down in recent years. They put him in a private homeless hostel, which is sort of a place with rooms where you stay. It was pretty bad, but he knew that to get a house or a flat, he had to stick it out. And he figured out a way to get into the building without being seen. That was something he'd learned back in his squatting days. And that helped him avoid the violent and dangerous people that he had to share the building with. And during that time, he spent his days the way he had when he was homeless and squatting. He could be found in the local library for hours reading about things he was interested in. He knew every place there was a free concert in the city. He walked, he rode a bike, he sold drugs. Those are the things he did to try to get by. The person that I know, he's now been securely housed for over 10 years. And he still lives as though he could be homeless at any minute. This may sound familiar to some of you from clients you've worked with. He carries a bag that's like a jump bag, with essentials in it, just in case, every day, all the time. Most of his clothes are stored in a suitcase, even though he has a flat and can unpack. He never feels at home. He never has. And he doesn't deal cannabis anymore, but he's never found secure employment. So he's kind of at the bottom of the social heap. And at 50 plus, because that's how old he is now, he is starting to, for the first time, deal with some of the adverse childhood experiences and adult experiences that he had when living on the street, including multiple violent assaults and, attracting possibly a PTSD diagnosis. His social network is tiny, like 3 people, maybe. And he'd be back right where he started if he lost his housing. He'd have nowhere to go but the street. So that's a story. And was that the kind of person that you expected? You probably had in your mind someone with autism would not be that clever, to be able to get through a really frightening situation, multiple frightening situations. But I will say, in my experience, neurodiverse people are often quite creative and resourceful. They use these skills to get by, also in street situations. This is the person who probably figured out how to get a solar panel somewhere and charge people's phones. This is the person who figured out how to get water on that illegal campsite. This is the person who knows how to fix cars, but they're not a mechanic. They've picked up skills to try to survive, and they find their way in communities by bartering those skills, not because they're social, which is how most other people manage to get by in the world of homelessness. They can also be really, really vulnerable because they don't understand the social situations that they land in. The street world is complex socially, and if you're not good at dealing with that complexity, it's easy for you to be taken advantage of, easy for you to find yourself in dangerous situations. And this is especially so for women who may find themselves extremely vulnerable in those situations. And if you have intellectual disabilities, in addition to another form of neurodiversity, or if you have autism plus dyslexia plus ADD plus maybe health conditions, you become one of those people that we're most concerned about in the world of homelessness and mental ill health. PTSD and additional mental health conditions will complicate that picture, and they are extremely common in neurodiverse adults because of the experiences they've had, but also because there's some overlap, probably in the genetics, but also probably just in the life experiences that people have had being quite similar. And substance abuse is also reasonably common. Lots of people in that world will use substances, whether that's alcohol, cannabis, or hard drugs, to try to get by. The impact of those early life experiences stays with people and often has a lot to do with how they behave when they're on the street, whether they link up with others to try to find support, whether they're willing to trust you as service providers, whether they're willing to go through all the steps of a program that probably wasn't designed to meet their needs, that might be in an environment they find challenging. They might be likely to not do those things because of the experiences they've had, as well as because of the way their minds work. And for people with ADD and ADHD, you have the additional thing of they may be quite chaotic anyway, in terms of whether they can stay on schedule, whether they can follow the steps of something. They really need to have that spelled out for them. So what's the size of the problem? There hasn't been any good research done in the US, but luckily in the UK and Ireland, there have been a couple of studies done. And unfortunately, they found that the size of the problem is quite large, about 10 to 20 times the rate in the general population. Autism is found in the homeless population. So even though you might think, I don't think I've had anyone like this just yet, I'm curious about autism in my homeless group, but I don't think I've seen it yet. You've seen it, you've been working with it, and you didn't even know. Some of you will know because you've maybe seen files on people or someone has told you about their diagnosis. What we often see first, though, is the additional mental health issues or substance abuse, and that is maybe masking the underlying issue. And it's important to restate again that many autistic adults are undiagnosed, and especially autistic women, and I'd add especially older adults, because diagnostic services really were hard to get until the last 20 years. So people who are in their 30s, 40s, 50s, 60s, and above, the higher you go, the less likely they are to have ever had a formal diagnosis or even have had it mentioned to them. Do you think it might be this? They may have attracted other kinds of diagnoses along the way, and you may notice something as you begin to work with them. The root of the problem, I think, the reason we see people here in these kind of desperate situations is the lack of support and services for autistic and other neurodiverse adults. The focus has always been on children, especially in autism, but also in ADD and ADHD. We all probably know an adult with one of those diagnoses. People will say it's trendy, but there's very little for those people unless you're kind of a middle-class professional and you can hire a personal coach or something. The services and supports have been focused on children and often focused on cures, and cures don't exist. There is no cure for autism. Mainstream services don't really get it. And when it comes to the things that help the typical adult kind of move on in life, those things often aren't there for the adult with autism. So fewer than 20% of autistic adults are in employment. That is a shocking statistic, really terrible. And the thing I tell you next is even worse. The rate's going down. You've probably heard lots about companies that hire people with autism or that were thinking about neurodiversity in the workplace, but in both the US and Europe and also Australia and Canada, the rate of employed autistic people is going down. The reason for that is we're expecting more in terms of effective labor in the workplace, being a team player, being able to get on with everybody, sitting in meetings all day on Zoom. We don't value that person who just gets on with the job. So even for a job like being a janitor in a hospital, that used to be a really good job for somebody with autism. We now want that person to go to team meetings, to connect on social media, to do lots of things that may not really work for that population. There are so few adult services that they're really hard to get access to. And the few options there are tend to go to the middle class and upper class folks. So the people that you see, the people who are at street level, are not going to get access to those. Some of them are paid for services. Some of them are services for which you need to be in receipt of specific benefits that can be hard to get. If you've ever tried to walk someone with autism through an SSI application, you will know what I mean. It can take 3 or 4 times. You've got to have all your paperwork together. You need evidence from your childhood about your diagnosis. It's just not going to happen for a lot of folks. And then even when you get into services like, say, supported housing, the quality is extremely poor. I know good programs, so I won't say it's always poor, but I do know that in group homes and even in some so-called clinical settings, neglect and abuse is a constant. The graphic that I've shown you here is from the UK, and that's the caption, "Punch me and see what happens, I'll put you through the floor." Now, this guy went to jail, I'm happy to say, But that had gone on for years in that particular group home before it was revealed. And we've had these crises in the UK. I could list a long list of homes that have been shut down, services that have been investigated and then reopened because we don't have anywhere else for people to go. The situation in the US is not different. The services are not great. We don't hire the best people to work there, and they're unreliable and poor quality. If you can find a good one, it's like gold. Please refer people there. Because of all the things I've just mentioned, sleeping rough can actually feel safer for some adults with autism than living in the kinds of situations that they are sent to. And that sounds crazy, but I've talked to plenty of people who've told me exactly that they would rather find somewhere in the woods to pitch a tent than to go back to that group home that they lived in, where they had to deal with abuse from other residents and abuse from staff and noise and nowhere to store their stuff and feeling frightened all the time and also being told what to do all day. Nobody likes coercion, but I will say people with autism just don't tolerate it at all. So I understand the feeling, but at the same time, I want people to be safe. And I know that sleeping rough can not be good for your mental health. So what can you do? What are the things we can do to meet service users' needs? I probably don't need to give you a lecture about person-centered services, but here it's essential. This is a really highly individual population. I can't even say people with autism do this. They're all like this. They all want that. Your one-size-fits-all service, even if it's an autism service, won't. It will not fit all. There are a lot of undiagnosed service users out there. And if you notice something that makes you think, I wonder if this person's on the autism spectrum, or I wonder if this person might be dyslexic or have ADD, getting that person to diagnosis can really help. So can helping people to get the paperwork about a diagnosis that they got in childhood, because that could be the key to their getting access to, let's hope, an actually good service where they're living. Even a living situation could come from that if we have the right piece of paper. And then we need to make sure that that piece of paper with the diagnosis is actually stored in more than one place so they can continue to get access to it when their stuff gets lost in a campsite sweep or bad weather or whatever. Staff do need some specific skills, but they're not skills that you have to necessarily be an autism expert or a neurodiversity expert to get. The biggest one is patience. You need to get to know people and give them time to learn to trust you. You need to show yourself to be trustworthy. Just saying trust me will not do it. Communication skills, and those should be both verbal and nonverbal. People have different ways of communicating. I've worked with people across the whole spectrum, from people who are very verbal, but the way that they speak is idiosyncratic and unusual, and you have to kind of roll with that, to understand what things mean to them when they say them, the way that they might diverge from topics and need to perseverate on things that are of super high interest to them for a while before they can get around to talking about what you want to talk about. That's one end. On the other side, I've worked with people who are nonverbal and who don't actually have any other decent communication system. For this group, they really need a communication system. There's a lot of communication systems out there for people who are nonverbal, a lot of which can run on a mobile phone now, so they don't have to be expensive. That was the barrier back when my son was young. There are things like picture exchange communication system, which is quite simplified pictures that you can use to communicate simple concepts and even make sentences. You can use them to make schedules. You can use them to explain things. You might want to communicate in writing. For some people, that's the thing that works for them. And I do think always backing things up with writing is useful, because then you have a record of what you said and they can keep coming back to it and checking. You need to adjust your communication to fit the mode of the person you're working with. And I know that can seem really challenging. It's a big ask for some members of staff. Ask and pay attention to sensory differences and needs. These aren't always negative. Some people have sensory preferences that really help them, like having something that they can hold actually helps them kind of hold on to their sense of self and where they are in space. I know a young woman, I didn't work with her, she's just someone that I know, who carries around a stuffed toy all the time. Actually, I know a guy who works for the BBC who's autistic who carries around a stuffed lion all the time. And that's what keeps him kind of centered. He's an unusual guy, very autistic. He's got full-time staff, but he's a brilliant programmer. And I think without someone saying, yeah, you can bring the lion to work, it's okay, he would probably be one of the people we're talking about because he wouldn't be able to hold a job without that prop. Other people have sensory differences that can make the world feel very uncomfortable. This can go right down to feeling the seams in their clothes and the tags in their shirts, to being super sensitive to smell or sound. These are people who may want to be as far away from other houseless people as they possibly can be. So the guy who's living up in the woods far away from everyone else, who's quite hard to reach, there may be a reason for that, and it could be a sensory difference. I think if you're thinking of making an actual service for neurodivergent people, it's important to co-create it with them. And because they're quite different from each other, you can't just pick one person with autism. You need a few. And it may be hard for them to work together because they are quite different. So it's a tricky process, but it has been done. It can work. And you'll get a service that matches up much more closely with the needs and preferences that people have, and that builds on the strengths that they have, because they do have strengths. That's why I told you that story, because, I could have told the same story in a very, oh, what a poor guy mode, but he's actually quite an intelligent and adaptable person who's found ways to live safely in dangerous situations. I think people know a lot more than we give them credit for sometimes. So some key takeaways for you. Open your eyes. You're working with this population now without even knowing it. When you see behaviors that you think, why is this person doing that? Things like avoidance. You come around looking for people and they don't want to talk to you. People who isolate themselves from the larger group or who don't seem to have connections with other homeless people. People who move in an unusual way. That could be dyspraxia. It could be autism. People who struggle with social relationships. There can be a lot of reasons for that, but this could be the reason. And people with communication issues, where you notice idiosyncratic or labored or lack of communication. Just kind of think, I wonder, could it be something more than just this person is a bit strange? Could it be that there is something actually clinically different? Mental ill health might be treatable also for this group. We hope that it is. But neurodivergence is not treatable. This is how people are. And so we have to meet them where they are. We need to accept them as they are. And we need to adjust to meet their needs. Many adults with autism, and especially women, because women get a lot of social skills training from an early age, that's just kind of how society works, they spend a lot of time masking, meaning that they put on a persona. It's a bit like a full-time acting job, that they're showing you a kind of self that they can turn on and turn off because they've developed that ability to try to get by in life. It's a form of self-protection, and it's also really exhausting. It burns people out. It makes them tired and cranky, and they really need somewhere that they can go to just decompress, and that is often lacking. I know quite a few very able people with autism who do a fair bit of that, and it's difficult for them. So if you see neurodivergence in your group, and it's there, I want you to see it, the next thing you need to do is get connected with people who understand it better in your area. And since you're in the US, I'd like to say who that isn't. That isn't the most famous autism organization in the US, which is Autism Speaks. They don't actually do anything for autistic people. They're a research organization. And I don't like them very much because their whole reason for existing is to try to eliminate autism, meaning eliminating autistic people. I don't like that idea at all. But there are organizations of autistic adults all over the country that advocate for themselves. They have the knowledge about where the services are and aren't. They can give you information about living with autism just from a person perspective, but also in your local perspective. So, for instance, if you have a group of 6 people with autism who you're meeting with, who are going to advise you, they can tell you whether a particular program that you've read about or seen something in the newspaper is safe, if it's advisable to send someone there, who there you might want to talk to, if it's a good program, what's missing and what's needed, and where some of the barriers are in, for instance, the mental health system or the local work scene or at local education establishments that someone might make their reentry through. Think about ways your service can adjust to meet the needs of these service users. So that might be around supporting communication, understanding behavior a little bit better, what the roots of it are, and that there's some of it that we can tolerate. Of course, there's some behavior we can't tolerate, and understanding the impact of sensory perception. So that means thinking about what it would be like to be in your space that you use if you are a person with autism or a person with dyspraxia, because they really struggle in some environments as well. You could be excluding people or alienating them based on their differences without really intending to do that at all. Autism-specific services can be a lifeline. I've seen some very, very good ones over the years. I think all of the vulnerability that neurodivergence can create requires attention when you're designing what you do, when you're planning support, when you're delivering support, when you're creating a new service. This is something you should be thinking about. But what about people with forms of neurodivergence? Will this work for them? Because they're an important part of your service user population. But it's hard for you to know all about that yourself. And I don't really want you to reach out to self-proclaimed autism experts. It's better to reach out to people who are experts by experience, by making those links with autistic adults in your area or with other neurodivergent people, because there's also organizations for people with dyslexia, dyspraxia, ADD, ADHD, and they have a lot of knowledge that can really help you to make a program that works well. So, in sum, this is a key subgroup in the population of homeless and mentally ill people, including those that you will be presumably working with in street response. They have specific needs. Those needs are individual, but you can also see some group characteristics that make a difference. And the system as it is really doesn't meet those needs. There are not sufficient services for neurodivergent adults. There isn't somewhere that you can just say, aha, you have a diagnosis, you go there, you'll get the help you need. So it means that we've got to respond in some way, right? We need new service and support forms that take their needs into account and that actually meet those needs in a way that removes the barriers to access that they're experiencing and improves their life chances. I'll end with this quote because it's the way that a lot of the young people and adults with autism that I've worked with feel. They spend a lot of time trying to fit systems that just really don't fit them. And when they do finally encounter someone who says, oh, I see you're a bit different. I can adjust to that. That's okay. Let's figure out a way that works for you. It's like the door just opens. For this guy, it was, feeling like a square peg in a hexagon hole. There's no way it's ever going to go in there. If people had just understood, he said, I'd have been all right. And this is from a homeless autistic adult. And he was talking about his experiences with homeless services in the UK, that he just could never fit within the kind of standard offer of organizations like Centerpoint or the Salvation Army. They assume things about the people that they see, about their literacy level, about their social connections, about their desire for social connections, about how they understand communication or what they mean when they communicate. Without the understanding of autism being added to that, he was never going to get the help that he needed. And once it was added, things got a bit better. So that's it from me, but I do also have some resources for you, and I'm happy to answer questions.